Kia ora. This is just some information around the clinical assessment for 7320. I'm assuming you're familiar with the online method that we use to conduct assessments, and we're not going to bring anything new to the table for this one. What you'll be faced with is a single patient who has an acute cardiogenic presentation. We're going to present you with some information during the preamble to this. This is going to include the location of the scene and the location of the nearest emergency department and tertiary care centres. You're going to have some virtual assistance too. You can ask for resources from a virtual dispatcher, some information from a paramedic on the clinical desk. Now, because of the nature of this assessment, the clinical desk will not be able to interpret the ECG for you. However, they can confirm information and they can discuss specific findings that you have presented. For example, if you see a wide complex tachycardia, clinical desk could agree or disagree with you about specific findings, maybe the presence or the absence of a P wave for that particular ECG. You can also ask for further information, such as old ECG findings. An example of that would be if you counted a left bundle branch block. As in actual life, they can discuss and advise on treatment plans and out-of-scope practice if you're required to do this. The central theme to the point I'm making here is that the clinical desk cannot provide ECG interpretation, but they can confirm or advise you to look further into your findings. They can give you more information and they can discuss your treatment options as well. The clinical expectations for the assessment align with the paramedic ATP. In other words, you need to provide assessments and treatments that meet the expectation associated with this ATP. The preamble we provide will introduce the patient and their surroundings. Once you've acknowledged these, you have a further 15 minutes to assess and develop a diagnosis and then describe the necessary treatments. At the end of 15 minutes, we may ask some questions about your diagnosis, about the differentials that you've considered, and we may ask you to clarify your thoughts around the treatment or the use of the CPGs. After that, we'll wrap it up, but we cannot discuss your gradings or provide you with any feedback. The interviews are going to take about 2 weeks to complete, and there'll be some moderation. Hopefully most of it will be done during the 2 weeks. We hope to release everybody's marks simultaneously once the moderation has been completed. That leaves the big question, what is it that's going to be in the scenario? Now, obviously I can't tell you, and by the time you've completed your assessment, you won't be able to tell anyone else either. We have limited choices though, and I'm going to list them now. Our first option might be to present you with a patient who has had a STEMI. Your job will be to recognise this, assess the patient, and initiate a treatment plan. You will need to focus on what resources you need and what access is going to be to PCI, or whether thrombolysis is going to be indicated for the situation you find yourself in on that day. The assessment phase will incorporate the use of the pre-PCI thrombolysis checklist. So it's going to be a pretty busy 15 minutes. On the good side, you're only having to describe these implementations rather than physically doing every element of it. So 15 minutes should be sufficient enough. And remember, we're not assessing local guidelines of what would normally happen for a particular region, but rather the generic approach to the national STEMI pathway. Alternatively, we could present you with a patient who has a symptomatic dysrhythmia. Now, it won't make sense for us to present you with an asymptomatic case because we need to assess your ability to formulate and carry out a treatment plan. The choices for a dysrhythmia would be bradycardia or tachycardia. Your job will be to recognise the nature of this, assess the patient, map the severity, and initiate or propose a treatment plan. Our third choice is going to be to present a STEMI mode. The patient will have some level of compromise directly related to the cause of this mimic. In other words, we're not going to present you with an ECG in a patient that's incidental to another illness. So what we're not going to do is give you a left bundle branch block, for instance, that coincides with a sepsis case. Our focus will be on one of the STEMI mimics that's presented during the block course. The case will be directly associated with a cardiogenic symptom such as ischemia, ACPO, or cardiogenic shock. And it's your job to recognise the historical and physical features in the presentation, identify what's going on, and manage the issues that are associated with it. If you've got any questions about the assessment, don't hesitate to contact someone on the team. In the meantime, I wish you all the best with your preparation towards this assessment. Ka kite.